Hello and welcome to Healthy Kingston, a health promotion and wellness program of the Kingston Board of Health. I'm your host, Janet Wade. Today I have the pleasure of introducing our new health staff in the health department, our health agent, Joyce, Krystofolski, and administrative assistant, Lorraine, otherwise known as Lori Jones. Thank you both very much for being here. Really appreciate it. I've asked them to give us an idea of their backgrounds, which are both very interesting, and also a little bit about what they do in the office, what they are planning, what their hopes and dreams may be for the office in the future. So it should prove to be a very interesting discussion. So with that, again, Joyce, welcome.
Thank you.
I wanted to ask you, you have a very interesting background. Can you tell us a little bit about what you've done in previous positions and how it is you became interested in the health agent position here in Kingston?
Sure. As you said, I've had a circuitous route through life. I started my early career as a therapist. In fact, I worked, one of my very first jobs was right down the street at a counseling agency. So I was a therapist for a number of years, and then I transitioned over to the probation department, which utilized the same skill set. And then in the early mid-2000s, I transitioned over into teaching at a college. I switched to culinary. I had previously worked as a culinary professional to pay for college, so it seemed like a good fit, and I wound up going back to school to further my education in that area, and that took me to 13 years in higher education, and then I transitioned back into the industry itself. So I've worked in a variety of capacities, from running restaurants to hotel kitchens to my last position was to oversee kitchens for an independent grocer with a few stores in a 2-state location. So it was great. It was something different every day. And
well,
then,
I've met eclectic people, but you are really a Renaissance woman. I mean, you have covered. Tell people you're totally right and left-brained. You have just covered the whole spectrum here.
Glad you think so.
Yeah, absolutely. So obviously food safety.
Yeah, so that was a big part of my last
segue.
position. Mm-hmm. I did a lot of oversight of development and safety and sanitation. And so given that in my previous backgrounds, inspectional services isn't a far cry, because it's dealing with the public, knowing your laws and regulations about food and how to handle situations that may arise where somebody may not be fully compliant. Mm-hmm. And so a little over a year ago, I transitioned to a health inspector position in another community just outside of Boston. And I had the good fortune of coming to Kingston the end of this past May. So it's been a great change for me. I'm very happy to be in this town.
Great. And I know you don't live far from here.
Nope, I do not.
So it's
a
a
much
wonderful
better commute.
Terrific, terrific. How have you found the position so far? How are you adjusting?
The position is great. Obviously, we have some challenges to sort of reorganize and help to get things in line with where we need to be, as far as especially around FDA. New standards are coming down, so getting inspections in line with that, helping to sort of make the department more user-friendly by digitizing and getting rid of paper files, so that makes it more accessible to the general public when they
Sure.
need something.
Mm-hmm.
And we're trying to work with some of our counterparts in the town hall as well to make sure that we're all on the same page, especially when it comes to like septic, working with not only conservation but the building department as well, to make sure that we're really following all the protocols that need to be adhered to make sure that we keep Kingston a safe and healthy place by making sure that those kinds of projects are done correctly.
Okay. So you've talked about septic. Obviously, you have expertise in food safety. What are some other issues that you're focusing on that you think are important right now?
Well, currently we're trying to hire a public health nurse, because that would be a great addition to the staff, to make sure that we, are able to fully perform during flu season with the flu clinics, to provide outreach. We work with the COA to provide blood pressure clinics. Currently, we do have coverage through a grant, so we do have a nurse that is working with us who is absolutely super, but that she also works for 5 other towns, so we have limited availability. So having a part-time health nurse, public health nurse that works for the town of Kingston will be beneficial, because it will help residents be able to get information around a myriad of health issues. So.
Do you have any future plans for the department, things you're aspiring to put in place?
I think that looking down the road, it would be great to have a social worker, a part-time social worker on staff. This is pretty common in many municipalities right now. Not so much to do the counseling part, but to be able to help residents access services. We need to have somebody that can guide residents through the process of finding a provider, finding what works with their insurance, or in certain circumstances, getting you to the right person. Hoarding would be a good indicator of that. Not every therapist is geared to work with that particular issue, so having someone who can help people to get to the right person is super important.
Sure.
So I think that would be a good priority to have for this department, as well as possibly another inspector going forward as the position develops here in Kingston. We'll definitely need to have a second person on staff to help with inspections.
And what type of inspections?
Both food. I would perceive it to be someone who is well-rounded and able to perform food inspections would be a big priority, but also allowing that person to grow into also helping with septic inspections as well, so that we have a well-rounded crew that can pivot if need be. You don't want to keep people waiting if you can help it, especially septic inspections. That's, you have a lot of different companies waiting on those inspections so they can move forward. So being timely and available is important. And also making sure that we stay on track with inspections in food establishments, and making sure that we're inspecting based on risk level at the appropriate increments is also important. And I think that right now, given the size of the department, we are meeting the minimum standard, but it would be nice to be able to bump that up.
Right. Well, particularly, are you noticing the impact on your department with the growth in housing of the community? I mean, with apartments and houses.
Well,
I would
we
imagine
are
that's
very
impacting
busy.
you as far as inspections are going.
Yeah, we're very busy with septic. And like I said, I am trying very hard to work with all of the installers to make timely inspections. In fact, yesterday I was able to conduct 2 different inspections. One in the morning, they completed a second phase of their septic, so I was able to go out and do the second piece of the inspection versus making them wait a whole nother day. That just allows the project to progress that much quicker,
Sure.
In a more timely manner, so that different trades are not being held up.
And I was going to comment on your need or interest in having a social worker. That's a fabulous idea. I mean, just over the last 5 years, I've been on the Board of Health, and surveys that we've done that mental illness is such an issue here, and drug use, and children and families having dealt with COVID and the aftermath of that, fires that have happened, that having a social worker to be able to help residents deal with those type of issues would be extremely helpful. So that's exciting. to me to see the department looking to develop in that direction. That's wonderful. And I think being that you have such a broad brush background, you can see the big picture. That's for sure. Right. And Lori, talking about a broad brush background, I know you've been in the position for several months. How many months now?
I believe it'll be 9 months the end of this month.
Wow, time flies. Oh my gosh.
Thank God.
Wow.
Yeah.
I didn't realize it had been that long. As the Minibus, oh, and by the way, kudos to you. You definitely kept the department together before Joyce entered the scene. So thank you very much. It's very much appreciated by the Board of Health and the residents that you served during that time. So tell us about your duties. I think residents need to know what you're all about, what you do, what you have to offer.
Well, I'm really involved in the permitting process. I manage all the permits for the town that come in, food establishments, food retail, anything that comes in permit-wise, making sure the paperwork's all done in a timely manner. I maintain the budget for the department, make sure we don't go over budget, under budget, make sure we get spending the funds wisely. I prepare the public hearings, Board of Health meetings. I record the minutes. I do some payroll.
That's a lot.
I assist Joyce whenever she needs me. So it's a busy job.
Absolutely. And you're the face of the department.
I'm the face of the department. Yeah. I'm the one you see when you walk in.
When you walk in the door. Yeah, absolutely. Good for you. You wear a lot of hats. Well, you both do. How have you found the position thus far?
I really like it. I missed working in an office. I was I didn't work in an office for quite a long time because I was raising a family. And I missed it. I did miss it. And I settled right in very easily. I love the job. I love working with Joyce. We get along really well. So that was great. I was nervous about, whoever came in, if we'd get along. But we work out great so far. And working in town hall, I just love everybody that works there. Everyone's super friendly and helpful.
Wonderful, wonderful. That's good to hear. You've spoken to it to a degree, but are there any particular issues that you feel you're dealing with on a regular basis that people need to be aware of is to come to you with them? You mentioned permits.
It kind of like, the issues that come in daily, it could be anything. Septic is the big issues that we're dealing with right now. There's lots of new construction, people are selling their houses, so we're getting a lot of requests for septic plans and things like that, and having Joyce go out and do those. So I'm trying to maintain her schedule and do that.
Yeah.
What else is coming in? I've learned that a lot of the issues that come up are seasonal, like permitting, farmers markets, and mobile food trucks. They all want their permits in the spring, whereas the establishments and retail, we have to get them all done by the end of the year. Summer camps, they all have to be permitted and inspected before school gets out.
Okay.
So, pool inspections have to be done before it gets warm, before Memorial Day.
Right.
So, those are the issues that we deal with. And a lot of time it is seasonal, and, I just take it as it comes.
I was going to say, is there any way you can anticipate that, or?
I can't really anticipate what comes walking through the door, like what kind of questions are coming in. So that's always a challenge.
Yeah.
Because I do the best I can answering them, and but I like it. It keeps me on my toes.
Absolutely, absolutely. I have no doubt. Any special projects you're working on? Well, you had mentioned Joyce, the electronic records. You're trying to change the paper records over to
we're
electronic
trying to digitize existing records so that, one, it makes it a lot easier to find stuff. We're not trudging up to the attic.
Yeah, we're trying to scan. We're doing it in slow little bits just to try to get it in. We're scanning all the retail food inspections right now, getting them all digitized. Then we're trying to do the septic plans, and that'll just make it easier for us to, if someone walks in looking for a plan, it's on the computer and we can look it up rather than having to dig through files and things like that.
And also, the older some of these septic systems can be quite old, and so the sooner we digitize them, the safer the record is, because like anything else, old papers fade, things get creased, and so by digitizing them, you know, the intention is to make it easier for people to be able to access those plans, but also to be able to read them effectively, to compare with what the current day situation is. And then I think the other thing that we've been working on is the permitting system online, and Lori can actually speak to that better than I can.
We're doing a lot of training with SmartGov to get the online permitting up and running. Hopefully the end of this year it'll be smooth sailing. So we've been in training classes for that. That'll be wonderful.
That would make life a lot easier.
It will, because it'll eliminate a lot of my chasing people down. I think a lot, probably about 90% of it. I'm hoping.
Yeah.
So that'll be a wonderful thing when that's up and running. I'm sure all the establishments will like it too.
Yeah.
You know.
To be able to go
We're also
online.
going to be switching to Food Code Pro as a means to do inspections for food establishments. It's a digitized system we can upload directly to files for posterity, as well as send directly to the business owner, so they're very aware of if there is a violation or something that needs to be corrected. It's instantaneous.
Oh, that's great.
It's also a lot more detailed than the standard mass form that's just checked boxes, so we can, write exactly what the problem is, and also provide information on how it needs to be corrected, which for some business owners, especially if they're new to the food establishment world, it will be a lot easier for them to know how to fix things. So that's in the process as well.
Plus, I would think it would make it a lot easier and faster
Oh,
when you
the
go
inspections
out
are a lot easier. Giving the right codes is a lot easier, being very detailed. And the more detailed you can be, the better it is for the owner, because it helps them. Food inspections are really a way to not only educate and correct, but also help a business succeed. Because if you're not aware of something and we give you an inspection and say, okay, this is how it needs to be done, and because these are the rules, it can help a business become better. It's not meant to be punitive. So I think that by this system, that's going to just increase the value of an inspection as well. We're also trying to put things in place to, I guess, hold people more accountable, and be more stringent about what deadlines are and when things need to be processed, so that, one, the department doesn't get overwhelmed, but that when projects are happening, that we are not holding up other trades or homeowners from progressing in their project because somebody's not adhering to the proper procedures. So hopefully that will help as well.
Terrific. That's wonderful. If you would, could you both speak to, I know, Lori, you're the one that maintains it, to the website for the department, like what it contains, what people need to be aware of that's on it, how they can use it.
The website for the department, it contains a lot of useful information. Not only it'll tell you who your board members are, who the health department is, who's working there, but we have, we post a lot of our regulations, we post all the applications for permitting, we have some useful information on Lyme disease, how to maintain your septic, COVID, and it's a very useful tool. So it's worth checking out.
So it would behoove people to look at that first before they even contact you.
It has all the episodes of Healthy Kingston.
Right, yes, thank you for that plug. Yes, and they're all listed chronologically, but also by topic. So if you're interested, for example, someone had contacted me about mental health concerns, and that they wanted to have some local resources. So they were able to go to the website for the health department and look at the Healthy Kingston list of topics and go to that specific program that we had. And I had a number of people who came in from Beth Israel Deaconess and spoke about mental health issues and where people could go for resources. So it's good information, and we've now done, this will be our 48th program, so we pretty much covered a whole myriad of topic areas. Ticks keeps coming up. That's on it at least 3 times. So rather than repeating the same thing, it's easier if you just go to the website and take a look at what's been discussed in the past. But thank you for that plug. This is your big chance to tell residents what you think they ought to know as far as the health department goes. If you could tell everybody what you think is important to know about the health department, what would those major points be?
I think first and foremost is that we are a resource. We're here to serve the town. So if somebody has a question or they're not sure about something, they should reach out to us. Again, the website has a myriad of information on it. It also could help you to not have to come into the office, because if you're looking for a permit, it's right online. You don't have to leave to come down and stand at the counter. But if you do want to come and visit us, we are here, we are present. We will do our best to provide whatever resource information we can to anybody who has any kind of issue. And if we don't know, we will do our best to find the right answer and provide you with that. Or point you in the right direction at the bare minimum.
Right. We're here to work with the citizens and the residents.
Right.
So we'll do our best to help them out. And if we, like Joyce said, if we don't know the answer, we'll find out the answer.
That's great. That's what it's all about. And I really like both of your philosophies, and that, you know, you're instructional, you're educational, the things that you're, the policies, procedures that you're putting across to the public are for educational purposes and not to be punitive. That's not what this is about. And it's truly to protect the health of all the residents, to keep us all safe and healthy, evidently. So I would say, as a town, we should be very appreciative that the two of you are in the positions that you are. Thank you for all your services and what you do for us. You certainly come with excellent backgrounds and are taking your positions very seriously. And we're very fortunate, and have you back a few months from now and see what other things have been accomplished. So thank you very much.
Thank you.
Okay. And everyone out there, please stay happy, healthy, and safe this summer.